Hi everyone, my name's Ali Schaefer. I work for the World Health Organization in the Department of Mental Health and Substance Use. It's a real pleasure to be with you here today and to be able to share some more information about WHO's special initiative for mental health. So why does WHO have a special initiative for mental health? Well, it's reflected in the need. The mental health statistics around our world are quite staggering. It's affecting so many people. It's affecting the quality of life and the global burden of disease on health systems. And it is also affecting the survival of people who are suffering from mental health conditions. Mental health is also like other areas of health in that it is not well funded, it is not well implemented, and it is languishing behind other areas in our health sectors. We see that there is a massive treatment gap around the world. We see that there is inadequate funding from health budgets dedicated to mental health. And we also see that this is a global problem. Even international aid development assistance is languishing behind other areas of health in their donations. We also have a real challenge out there with the mental health workforce. In some countries, I can use Zimbabwe as an example. The whole nation, the whole population of Zimbabwe has access to only 19 psychiatrists, 18 of which are located in the capital city. So that just gives you a very clear snapshot that there are many issues facing mental health and the need to really start actioning it and trying to reduce that treatment gap. I also would be remiss if I didn't mention mental health and COVID-19. COVID-19 has brought about a lot of dialogue in relation to mental health, and that's a dialogue that we very much welcome at World Health Organization. We know that mental health services were significantly disrupted at the height of the pandemic. It has affected school services, access to medicines, and it has affected people who had mental health conditions before the pandemic, and it is affecting people who are in need of mental health services as a consequence or in the midst of the pandemic. We also need to remember that COVID-19 has an inherent link with mental health in that people who live with mental health conditions may be more at risk of contracting COVID-19. And if they do contract COVID-19, they're probably more likely to have more severe symptoms and a longer period of recovery. We also know for people who are experiencing this so-called long COVID, there are some significant and major neurological concerns around their recovery. So mental health is intersecting with COVID in many ways, and it's something that we can't ignore. So if we have an increased dialogue about mental health and everybody knows that the needs are urgent and everybody knows that there is more investment that's needed, we also know that there is some evidence out there. There's lots of evidence actually about what we need to be doing. We know that there are evidence-based treatments and evidence-based therapies. We know that there are some approaches that are more effective than others. Why is mental health still languishing behind? And I just wanted to insert this slide here to help us think about this a little bit, because we often wonder if mental health is sometimes neglected because it may seem somewhat overwhelming. Mental health is not like many health conditions. There is not one diagnosis for mental illness. There are many. Mental health differs if someone has a psychological or neurological or substance use problem. The severity differs. The access to care is needed at all levels of healthcare, not just one level of healthcare. There are community supports that are needed. So mental health not only works in the health sector, but also needs to cut across other sectors. And there are all these other intersections of mental health with other areas of health. So we know that people with communicable, non-communicable, or neglected tropical diseases, like COVID, have this cyclic interaction with mental health. People with mental health conditions are more at risk of these kind of illnesses, and people with these illnesses are at more risk of mental health conditions. And so everything seems to work together, and it differs again if you think about the lifespan, the treatment that's required that would be different for children versus older adults. It's a massive area of work. And so we do wonder sometimes if perhaps mental health is languishing because it is not an easy area of health to be working in. This dialogue has continued about mental health for many years now, and it's not all doom and gloom. Mental health was recognised in our Sustainable Development Goals under Global Goal number 3. Mental health has featured in WHO's General Programme of Work and their Triple Billion Goals. And back in 2013, the World Health Assembly approved a Global Mental Health Action Plan that was intended to go to the year 2020. And these were the 4 objectives that the action plan was intending to target so that we could accelerate and increase mental health services at that point in time. We got to 2020 and sadly we realised that very little progress had actually been made. And so this year, the World Health Assembly has approved for that Global Mental Health Action Plan to be extended to 2030. The objectives remain the same, but the targets and the indicators have changed a little, along with a little update of language. So mental health is getting the recognition it deserves. People are knowing that it's needed, but it is still struggling. And this is why in 2019, Dr. Tedros launched the WHO Special Initiative for Mental Health as part of WHO's Universal Health Coverage Agenda. The goal of the initiative is that over a period of 5 years, working across 12 countries, we might be able to ensure access to 100 million more people with mental health services. And we decided on 2 very important, critical, and more urgent strategic actions. These are around advancing mental health policies and human rights. And this is because people with mental health conditions and psychosocial disabilities are still experiencing rights violations in so many areas of their lives. It's really important that we try and update this and improve this situation as a matter of urgency. We've also decided that it is the scaling up of interventions across all levels of healthcare. This ranges from communities, primary care, secondary care, and in some instances, the need for tertiary care. Now, many of you might be noticing that we have not prioritised in the special initiative things like suicide prevention and awareness or prevention and promotion of well-being. We've not prioritised research or information systems as much. WHO in our Department of Mental Health and Substance Use still works in these areas. These areas are absolutely critical to an overall approach to mental health care. However, the special initiative really wanted to focus on these much more pressing issues so that if we can get these right in these 12 countries and we can actually understand how to go about sustainable change for mental health care, we might then be able to do that in other countries and start to actually deliver a complete picture. So the special initiative is not like other programs or projects that are common to mental health. It values the complexity of mental health and mental health services that I mentioned before, and it very much takes a health system strengthening approach. And I insert mental there because it is a mental health system strengthening approach. We are working directly with Ministries of Health as the primary implementers of the work plans for the special initiative, and we are committed to working with these ministries for a period of 5 years. We also seek that commitment from ministries to work with us for that period. So every country participating in the special initiative has also endorsed in writing their commitment to work with WHO on transforming mental health systems through the special initiative. We work with local consultants, local expertise, local leaders, and we engage all levels of WHO to support the implementation and the development of the special initiative over time. And of course, we're encouraging a lot of cross-country learning, which is happening, and I will present to you in just a moment. You notice that we originally wanted to work in 12 countries, but unfortunately, funding was difficult to mobilise in the early days of the initiative. We received some generous funding and support from SDC and USAID in the first year of the initiative, and we were able to begin planning work in Bangladesh, Philippines, Jordan, Ukraine, Paraguay, and Zimbabwe. At the end of 2020 and this year, we were enormously grateful to the Norwegian government and to NORAD for their support and for coming on board with the vision of the special initiative. And that has enabled us to do some planning work with Nepal this year, who are ready to implement as of this month, actually. And also as of this month, we have received commitment from the Ministry of Health in Ghana to begin work there. We'll do some planning this year and some implementation next year. So what do each of these countries do? I'll go through this very, very quickly and just say at the beginning, we do a rapid situational assessment looking at the policies and the prevalence rates. We look at the barriers and the strengths in each country, the mental health workforce, the way people seek help in these countries, things that are unique to each of these countries. We then undertake some multi-stakeholder consultations so that we can establish a specific special initiative for mental health work plan. We had intended to do all of these face-to-face. We managed to do that in just one country, that was Ukraine, before COVID-19 came. And the rest of our consultations were held online, mostly throughout 2020. Each individual country establishes their own work plan with their own indicators. And for most of those first 6 countries, we have started some really good and positive implementation that has been going on this year. We need to still do some work on our monitoring and evaluation. And so that's going to be a priority for the rest of this year and also next year. And ongoing implementation of these work plans will progress as time goes on. So what are we actually learning? One of the interesting things that we've found is most of the countries that we're working in actually have national level mental health strategic plans. But often these plans are poorly disseminated or communicated. They're often not allocated any funding for implementation. There's difficulty in coordinating the messages of strategic plans from national to provincial or district levels. There still seems to be this big and over-reliance on facility-based care. And sometimes the action plans are a little more conceptual and abstract, perhaps not practical enough. Because these national action plans are struggling to be implemented, this also often results in countries still being opportunistic to accept activities that may not be linked to their strategic plans. And I don't play a blame game here, because if a country is struggling to get any support for mental health, any opportunities to do work there would be welcomed, whether they fit with the mental health strategic plan or not. But this links to the fact that if we're not actually funding these plans for implementation, it becomes harder and harder for countries to actually stick to their plans. The other thing that we've learned is monitoring and evaluation of mental health in system strengthening approaches is quite challenging. So let me just describe to you that all of our special initiative countries will assess 3 main indicators. These will be access, treatment coverage, and improved attitudes about human rights and person-centred care. We will try and establish a common methodology across all countries to assess these indicators so that we can collate and aggregate that data and report on the success of the initiative overall. However, each country is unique. So each country has also established their own M&E framework, and they will have their own country-specific indicators. Interestingly, what we're discovering now is that some of the indicators and the M&E frameworks that were designed are not necessarily practical to measure. And so there is some back and forth that's now going on with countries and ministries to try and make that more realistic and to ascertain how we're going to go about measuring this. That's why baseline has taken a little longer than we had first anticipated. The other really fascinating learning that we have for the special initiative is that now we've had 7 consultation processes and we're about to enter into one with Ghana. And these consultations have included different stakeholders, you know, similar people from ministries, academia, persons with lived experience, community-based organisations, different sectors. But even though they've taken slightly different consultation approaches, had different stakeholders and are in different countries and regions, they've all actually come up with really similar areas that their mental health systems need to strengthen. Governance and leadership has been prominent in every country. Some policy and legislation in countries is urgently needed to be updated so that it complies with international human rights standards. And finance continues to be a real sticking point for these countries. Not just how do we increase funding, but how do we manage funding? How do we plan for funding? What's actually required in the health economics side of mental health care and mental health systems? Everybody is acknowledging the need to improve the mental health workforce and the need to be ready to respond to emergencies, which is including the need to respond to the COVID-19 recovery plans. Most countries need to continue working on their rights and the inclusion of people living with mental health conditions. And I have to say, even for countries that are more advanced in that, we can never monitor that too much. You know, rights is something that can slide so quickly and so easily. And so this is something that we want all of our countries to continuously do. Integration with primary health care is really, really big factor because so many mental health services are so centrally located in big and capital cities. We absolutely need this integration into community primary, secondary levels of healthcare so that they're more accessible to communities no matter where they live. And of course, everybody is recognising we need to integrate with sectors outside of the health area, and we also need to integrate with other areas of health work. And we'll talk a bit about that in just a moment. I said before that some areas were not a priority for the special initiative, although they're a critical priority for mental health overall. Community supports, health information systems and community awareness have snuck into some of the plans, and this is because they're kind of linked. So for example, if a country is focusing on reducing dependence on facility-based care, that means they have to make an extra effort to ensure community supports are there for people to receive assistance and participate in their communities at those levels. Health information systems is sometimes linked to finance. How are we ever going to justify additional funding for mental health if we don't have the data in the health system? And community awareness is something that we're all thinking about too in relation to this supply and demand requirement. I mentioned that everybody sees that there's opportunities for integration with other areas of health, and that includes with communicable, non-communicable and neglected tropical diseases. I wanted to make you aware that actually in the last few years, WHO did issue some guidance around the mental health of people with neglected tropical diseases and provided some recommendations for how neglected tropical diseases and mental health can be integrated. This largely is around 4 areas. It's around the policy area. It's around ensuring that mental health is part of the funding that goes into neglected tropical disease responses. It's about educating and working with NTD program managers so that they know what are the best approaches and the evidence-based approaches to integrate mental health care to their programs. And of course, it's about health service providers, being able to encourage health service providers to perhaps screen for mental health conditions, know where and how to refer people for such treatment or care if it's needed. So there are all these ways in which we may be able to improve the integration with these communicable, non-communicable and neglected tropical diseases, and at the same time address some of those cycles of mental health that interact in these ways. So the Special Initiative is already facing some challenges, and this is not surprising. It actually excites me a great deal that we're facing some challenges. This integration work is not easy. I'm sure you'll all probably agree. It sounds good in theory, but what does it mean in concrete terms? And that's something that is different in each country. And it's something that we need to really think through and work together on. Monitoring and evaluation, I mentioned, is a little tricky for us. And that's something that we need to try and understand better how to do and how to do it more efficiently. We've had a constantly changing government staff in our Special Initiative countries. In fact, out of the 7 that are operating now, we've had significant changes in 5 of those governments over only an 18-month period. COVID hasn't helped that, but you know, changing government staff is a challenge that we have to roll with all the time. We need to also think in our Special Initiative about what are our urgent needs. We need to close this treatment gap, but then how do we do that when some plans, such as workforce development, are actually long-term? In 5 years, we're not going to train all new psychiatrists. So we have to think about strategically managing implementation and the work that we're doing when we think about short-term and long-term needs. Of course, mental health can't be implemented without a health workforce, and this includes the general health workforce. And we're very cognizant that they're an exhausted health workforce right now, and probably will be for a number of years to come. So some of the things that we're also thinking about is how can we integrate, how can we promote mental health care in our communities and different levels of care without adding extra burden to this already overburdened workforce. So that's something that is that we're not sure what the solution is at this point, but we're working on trying to think of some innovative and creative ways that we might address that. Some other challenges include how do we actually balance supply? I mean, if we do increase access to mental health services to 100 million more people, how do we know that communities are going to utilise those services and we're going to realise treatment coverage as a result of that access? And this is an interesting challenge for mental health because mental health still carries quite a lot of stigma. And I'm sure that that's probably something that mental health and neglected tropical diseases may well have in common. We need to reduce this dependence on facility-based care and how we can train our mental health workforce without this reliance on psychiatric teaching hospitals, which often promote long-term facility-based care. We need to continue working on resource mobilisation, but we need to also now work with health economists. And this is going to be a feature of some of our HQ support work over the next 12 months. If we talk about increasing mental health care and increasing budgets, does that just mean more money? And in truth, it probably doesn't. We need to be more sensible in how we spend the funding that is already allocated. We need to think about how we guide our governments to allocate funding to primary, secondary, tertiary level services. We need to think about how we can maybe leverage funding from non-health sectors for mental health, and how we can actually measure then what a total budget for mental health is if it cuts across multiple sectors. So there's some exciting health economics work and investment case work that's being done and prepared for the next few months, for the next few years. And this will also influence some of that financial requirement that is in each of the country's work plans. This is a really speedy summary of the Special Initiative. I encourage you to go to the Special Initiative website. You can get more information, see its theory of change, understand it a little bit more, and learn more about what the individual countries are doing and their individual work plans. I hope this has been informative for you, and I look forward to our discussion that follows. Thank you.